how to get into your healthcare business. So it's just generating income, generating revenue is the guts of today's first part. I'm going to tell you why health professionals operate poor businesses. And I've purposely spoken to a few of you already this morning as you came in about your business, and I've already got some ideas about what you need to work on, so I'll share that with you today. I'm going to tell you there's only really 4 ways to grow your business in healthcare, but I'll tell you how I've gone about doing it and how I think you can borrow some of those. There's proven ways to increase your number of customers at little or no cost. I expect you to walk out of today with ideas on how to generate more income, more patients, more clients without spending an extra cent. I think we sometimes think it has to be a great marketing campaign and a great radio or newspaper advertising program. That's not the case. I'll talk about that today. I'm going to tell you how you have to stand out from the competition, what things you have to do in your business, and you might have to come up with some ideas on how to do it, but I'll give you some ideas what we've done in our organisation to do that. How to charge more and do less, which I think is a pretty good thing for most of us to get, because most of us healthcare workers are totally frazzled. We're working our fingers to the bone, hands on, hands on, hands on. I'm going to try and talk about some other things today. And basically, how, as I said, to increase profits with little or no marketing budget. That's kind of my plan today. Let's get started. Now, my beautiful wife Helen hits me with this when I get a bit stupid and carry on at home and get too caught up in work. But yeah, but Hammond, we'll pass it around today. At some time today, you'll go, yeah, but that won't work for me. Yeah, but I can't do it. Yeah, Wrighty can do it, but I can't do it. That won't work for me. If that happens, can you put your hand up and do this? I love this little tool. You want a ready champion? He's got his hand up already. At some time today, you will need this hammer because you will think I can't do it. I'll tell you now, if I can do it, anyone can do it. This is not rocket science. And I want you to also keep your wicket-keeping gloves on. What do I mean by that? I've been to talks that I've picked up one idea from that have made me thousands. It'll take one idea today to change everything that's happening in your business. Now, if I don't give you that one idea today, I'll give you money back. That's the deal today. But keep your wicket-keeping gloves on because you don't know when that little edge is going to come to you. Why do we have poor businesses though? So why do health professionals fundamentally struggle with this concept of business? I pulled out 10 reasons why I think we struggle. The first one, we worry too much about our clients' finances. Oh, he's a pensioner. Oh, he's had a hard time. Now, please, you'll sit here and think, gee, Paul's a bit harsh. He has no empathetic bone in his body. I'm telling you, you studied a long time to be good at your profession. You should be paid and rewarded for it, which I think we struggle with. We struggle with, oh, they haven't got any money. Okay, so that's number one reason. We worry too much about our patients' finances. We're too focused on the consult. We just want the total consult to happen. And whilst I think that's important, that's the guts of your business. You have to have a good product, but you have to think bigger than this. To tell you an example, I actually do a consulting session at the moment, Monday mornings at my Katara practice. So I do 4 hours consulting a week, and I'm trying to get rid of it, but it's on the way out. But I've got these 4 hours a week of seeing patients. And I was talking to one of my patients the other day, oh, where do you work? Oh, I work at this national sports retail store. I won't mention the name. Oh, okay. Do you have a physio that has anything to do with your organisation up there? No. Tell you what, give me your manager's name, I'll give him a call. Oh, that'd be great. Now, that's not rocket science. I've just found a lead. I went and saw the manager of the store. I'm doing in-services for their shoe department next week, and they're going to put a little thing in every shoe that goes out, a little insert. We'll give them a free something or something to get them into the clinic. Now, I wouldn't have come out if I didn't look beyond the consult. Your patients are a ready-made source of leads for you guys. You're just sometimes not picking them up. Drives me crazy. Experiment with inviting your clients or customers to change their behaviour to make your product work dramatically better. So what can you change in your business to make your product work better? And you think, how does that work? Some examples for you. We've started playing with online bookings at our computer systems. We use a TM2 appointment book system. We're online bookings. So we're getting people to come on and try and log on and make appointments online rather than ringing our number. So now, it doesn't hurt overnight, but it's something to set you apart. I'll tell you now, even if no one uses it, it got us into a company in St Leonard's who wanted that service for their computer-generated people. It gave us a nice lead, and they would only have us on board as a corporate sort of partner if we had online bookings. Whether they use it or not is irrelevant. Sometimes it's just the fact that you can sell something. It sets you different than the rest. That was a good one. The value of your service diminishes over time. the value of your service diminishes over time. Let's say I do a 1 hour consultation for someone, okay, and because it's a great session. The maximum value I can charge, or the perception of the maximum value, is at the end of that consultation. It's worth the full amount that I'm charging for it. The person says, Paul, you were great. I loved the session. That's exactly what I wanted you to do. Tremendous. Where do I sign? Let's say they go away for a few days. The further away that consult is, what did Paul do in that session? Then he gets the bill in the mail. Gee, that's a bit pricey. Not real happy with that. The longer it goes, and then your chance of getting the money decreases markedly. Get the money at the time of consult.